going to show you the central line dressing change. It's a sterile technique. We're going to use chest to chest, and we'll go from the beginning to the ends. I've already shown you a picture of the supplies that you need. So after I've checked my order, provided privacy, hand hygiene, explained the procedure to the patient, I'll prepare the patient by lowering the bed linens and lowering his gown to reveal the central line. I can see that it is labeled. Check your hospital protocol for how often you will change the central line dressing. In general, it's every 3 days. However, if there is a gauze that is underneath or an occlusive dressing, that is every 24 hours. At this point, I can apply a mask to myself. I will use my clean gloves and an alcohol pad if necessary to remove the old dressing. And I'll gently peel the old dressing to the center of the line. And again, this part, just clean gloves are necessary. Careful not to irritate the patient. Go as slow as you need to the patient's comfort. And I can create my germ ball with this. I'll remind the patient to turn his head, his or her head, to the left in order not to breathe on the open area. In my kit, after I open it, this part is the sterile portion. I either bring a glove of my size or I can use the one that is in the kit. At this point, I will grab the mask and I can offer it to the patient at this point. Or again, they can turn their head. Of course, if this patient had a head, I would apply it to his nose and his mouth. So now I will go ahead and I will begin the sterile portion, and I will apply my sterile gloves. Remembering the sterile technique. I'm right-handed. I apply my right hand first, grabbing the areas that will be in contact with my hand. When I apply my other hand, I reach underneath the cuff and then slide my hand. Careful not to contaminate any portion of my gloves or hand. So now I'm in the sterile portion. At this point, I'm looking at my supplies. If the site was oozing, I can use this fenestrated drape or fenestrated gauze after to attach it to the area of insertion to grab any drainage that is occurring. According to your protocol, or if the patient is allergic to iodine, you would not use iodine. At this point, I will use my chloraprep and I will snap it open. I will grab the central line. At this point, my left hand or my non-dominant hand is now contaminated. I will continue to hold it to remind myself not to contaminate any other portion. I let the chloraprep drain into the pad and I start cleaning. We will use a circular motion, continuing to work outward. Now, after I've cleaned the circular area, I can use the edges and clean the tubing. If it's very crusted with dried blood, I can also use the alcohol swab sticks to help loosen that dried blood. I let the area dry for a second or two. On a human person, it does dry a little quicker. I am now done with the sterile portion, so I can go ahead and drop the tubing, and now I am free to use both of my hands. Again, if it was draining a lot, I would apply this prior to using the rest of my supplies. This is the transparent dressing that we will use, and we will apply it with the entry of the central line to about the center of the dressing, making sure to get all air pockets out. Label my dressing. I can go ahead and take my gloves off at this point. Again, we are in no need of sterile gloves anymore. And I can label my dressing with my initials, today's date, and the time. At this point, I can remove the masks and make my patient comfortable. Then I will dispose with all materials as needed. Thank you.